Hello, good afternoon. My name is Dr. Chudi Ufundu of Snowspirations Global Health Solutions. Thank you so much and welcome to today's Maternal and Child Health Clinic. Today is Sunday, the 13th day of June, 2021. I hope you're having a wonderful weekend. If you're a Christian, I hope you've gone to church. I hope you've prayed. If you notice, the first we have three power words in our group. The first one is praying. So we pray a lot. So I hope you've gone to church to fellowship with other brethren. Now, if you're not a Christian, praying is also important. So if you're a Muslim, I hope you've prayed. We pray a lot. So thank you for coming. I hope you're planning for a very beautiful week. The month of June, it's far gone. So we've gone in the middle. So by Tuesday, it should be June 15th. You have about 15 more days to end June. So I hope you're actually doing a lot better. I hope you're also playing. Playing means every 48 hours you meet with your partner. And I also hope you're practicing. Practicing is actually the concept of today's broadcast. So practicing means having a fertility specialist who will help you to navigate the difficult terrain, the challenging terrain of problems you might have, which might stop you from becoming pregnant. So practicing is very important. Practicing means if you've been wanting to become a mother, if you've been wanting to become a father, and you're not able to become a mother or a father by yourself, getting help, getting professional help, it's important. So the three concepts, the three basic mantra, the three basic motto of this group, it's praying, playing, and practicing. If you want to be a mother in 2022, if you want to be a father in 2022, if you want to be a grandfather, if you want to be a grandmother, some of you might be great grandmothers. So you actually feel free to invite everybody in the family. The family is a basic unit, but at the center of the family is the woman. So my prayer and my belief and my faith is that every woman who wants to be a mother can become a mother at any age. Motherhood is a labor of love. Motherhood is a decision you make. Motherhood is a choice you make. It's a binary choice. It's either you are a mother or you're not a mother. And I'm telling you on this day, in 2022, you can choose to be a mother starting from today. How can you do that? You can become a mother naturally by meeting with your partner. And if you're still within your reproductive phase, you can become a mother naturally. That means when the penis enters the vagina and at the peak of sexual intercourse, you pour the semen, which contains the sperm. And luckily, if there are healthy sperm and if there's an egg that was viable, you can become pregnant through that means. Now, you can also become pregnant through the help of fertility specialists. So we can place you on fertility treatment. This will bring us to the first topic for this month's summit, Clomid. So you can become pregnant with the use of Clomid, but Clomid is not for everybody. Clomid can actually harm you. Clomid can place you in a very bad place. Clomid can actually make your situation worse. So if you need to know more about Clomid, what's Clomid, how does it work, how can it help me, how can it harm me, how can it lead to cancer, what exactly is Clomid all about? Please register today for the upcoming summit. It's going to be on a Sunday. It's going to be on the 27th. It's going to be by 9 p.m. So we encourage you to come along. If you've been using it in the past and you haven't been following instructions, a fertility specialist didn't give you the Clomid, you are taking poison. So stop, then show up, let's fellowship. Now, some of you also have fibroids. And for some reasons, in life, there are certain things that God gives certain people. So if you're black, a woman, the possibility you will have fibroid in your lifetime, it's about 6 out of 10 women out there, blacks, will have fibroid. So I encourage you to register for the Clomid and the Fibroid Summit. That will be the basis for the summit. The summit for this month is going to concentrate on knowing more about the mechanism of Clomid, knowing more about the whole spectrum of fibroids. How can you have fibroid, defeat fibroid, become pregnant, defeat fibroid, and have your baby? What can we do? What type of fibroid do you have? What type of fibroid will lead to delay? What type of fibroid will lead to miscarriage? What exactly is fibroid? Now, you will be doing yourself a kind of injustice if you don't have adequate knowledge. If things you can change in your life, you didn't change it because you're not taking a bold step. What I know, since I started this journey in 2015, there is one particular group of people that always have results. People that step out from their comfort zone. You see, life is difficult. Anybody telling you that life is not difficult is deceiving you. But guess what? We are tough people. We are made of tougher material. So even when life gets tough, we can be tougher. So for everybody God gave life today, God equipped you with things you need to overcome. God equipped you with the knowledge, with the attitude, with the practice you need to overcome your infertility. So your infertility expires. It's my belief that today will be the first day you will imbibe the knowledge you need. You will imbibe the change in attitude you need. You will change your practices. You will change your perception so you can become a mother exactly how God wants you to be. Because when God chose you to be a woman, God chose you to be a woman because you're the light in the community. You see, women, we are nothing without women. Whether you like it or not, whether you bully them or not, whether you don't regard them or not, if you don't have a woman in your life, you are completely finished. You know, there's a difference between finished and completely finished. You are completely finished. We all need women in our life. Without women, the society will be a complete, desolated place. So we want our women to be more knowledgeable. We want to give them back their power. We want to empower them to know what they need to do at record time. Unfortunately, we are in an era where we have so many dissemination of falsehoods, especially if it's related to religion. So it's possible you've gone to church today, right? It's possible you've been having infertility for 10 years. And you've gone to church, they've prayed for you, probably played drums, music, and they prayed for you, probably for 2 hours. Now, that's important. That's one aspect of becoming a mother. Now, when you have said your prayers, are you making love enough? When you have made love, are you practicing enough? Are you attending master classes? Are you getting your PDFs? Are you going for consult? Are you being referred? One of the key factors which we discovered, which led to so many women not being able to do what they need to do, is lack of referral services. So there are so many specialists, amazing providers in Nigeria. But if you don't get recognize your fertility, and unfortunately, like I keep preaching, the word of a woman is timed. Once you don't use your opportunity when you're younger, when you get older, it begins to be difficult. It doesn't make you a bad person. You can still be a Muslim, you can still be a Christian, but you might be a Christian and a Muslim without a baby. So you need to gather the knowledge you need so you can become who God said you will become. So the month of June, it's going to be used to acquire more knowledge about Clomid. The month of June is going to be an opportunity to know what you need to do if you have fibroid. How can you overcome the fear of fibroid? If you're planning to go for your fibroid surgery, what are the basic things you need to check? Unfortunately, in the past, we've had stories of women that died from myomectomy. Myomectomy is the surgical removal of your fibroid. Nobody in our group deserves to die wanting to have a baby. Now, nobody also deserves to have pain. Women are already in pain constantly. So I don't want you to have additional pain. So what I will share with you today, it's just basic knowledge. So today's clinic is going to be a press follow-up, a press update to the upcoming summit. It's going to be on the 27th. That means after this weekend, the upper weekend, and the next. So you have approximately neighborhood of 14 days to register. Now we are only going to have provisions for 100 people. Make sure you make the list of these 100 people. What I will guarantee you, if you can come as you are, if you can live the knowledge you think you know, and you imbibe the right knowledge, and you renew your mind, and you work out your salvation, and you come out from your comfort zone, you will be a mother. The only person that will stop you from becoming a mother in 2022 will be you. Now review your relationships. Some of you are in dysfunctional relationships. If you and your partner are no longer on the same table, review. Figure out where your partner is. So if your male partner is not able to go for his seminal fluid analysis, find out why. What are your options? Unfortunately, in the whole equation of marriage, men have an advantage over women. Because as a woman, if you're not careful, if you're waiting for Jericho wall to fall and you enter menopause, that's the end of the story. That's a fact. So I will only share the facts with you. So you have a disadvantage. You have a lot of things to catch up with. Now, I'm not here to spiritualize or to sensationalize whatever reality we know. The fact remains that women are special. So there are certain things you're supposed to do at certain age in your life. If you don't do that, it might be late. So if you're attending my clinic today, you're a child of God. You're a daughter of God. Nothing can change that. But you need to act on time. Because you have a particular time you are supposed to carry out your role as a woman on this world. If you don't do that, you're going to be at a very, very big disadvantage. So thank you for coming. My admin is in attendance. Now, if you need to consult with me, very, very possible. I can help. The reason why I show up every day against all odds, today is not the best of the days for me. There are so many things going on, but I still have to show up. I'm here to help you. Please consider subscribing. Please don't send messages to my inbox. There are thousands of messages there. That's not the right way to seek help. The right way to seek help is to go for subscription. You can come in at 1 week. 1 week is enough to get help. You can come in at 1 month. You can come in at 3 months. You can come in at 6 months. Now, if you desire to retain my help, if your problem is going to drag for a long time, I will personally advise you to come in at either 3 months or 6 months. Why is it important to come in at 3 months or 6 months? Because you need ample time. Let's assume you're going for IVF. Let's assume you're already pregnant. You don't want to be getting services, do measure. You don't want to be getting services that will kind of cut short in the middle. You want to have sustained services, sustained access. So you continue your consult. Remember, getting pregnant is just one part of the equation. When you get pregnant, we want your pregnancy to be effortless. We want your pregnancy to be smooth. There are a couple of things you're going to contend with, but the things we can fix them. So if you and your partner are on the same page, you can actually have a group. There are few partners, very user-friendly partner. Some of them will come and say, oh, can my husband join me? Yes, I can create a group for both of you in my WhatsApp. Right now, we are still using our WhatsApp for our correspondence. We are hoping that our app is going to get ready. Once the app is ready, then everything is going to be automated. But I can create a group for you and your partner. Both of you can be in that group from 6 months to 3 months. So both of you can be there. We can even have scheduled call. The only packages that will give you opportunity to talk to me is Classic or Prime. So 3 months or 6 months. The other two packages we can consult, I can review, then I can refer you. Practically everybody that will be subscribing will get access to referral. So follow the admin if you're in Abuja, if you're in Lagos, if you're in Asaba, if you're in Enugu, if you're in Oka, if you're in Port Harcourt, if you're in Osun, if you're in Jos, if you're in Kano, we can refer you. It's important you see the right kind of doctor. The beginning of your journey to motherhood starts with seeing the right kind of doctor. A doctor that will tell you the truth. A doctor that will stick with you. A doctor that will give you the best advice. A doctor that will make sure you're treated properly. Unfortunately, we are living in an era where so many women are abused. So many women are stratified. So many women are stigmatized, especially if you're a woman in Nigeria. The biggest crime to commit in Nigeria is to be a woman and you're not married. The second biggest crime to commit in Nigeria is to marry and you don't have a baby. They consider you like a nobody. Now, I'm telling you today that against all odds, you can be a mother of one, you can be a mother of two, you can complete your family, you can defy the odds, you can gain back your confidence. The only person that will stop you is you. Now, when you go out there, don't allow anybody make you feel bad. Nobody is bigger than you because they have a baby. You are a child of God. Now, I know that having a baby is going to make you complete. The biggest joy in life is the joy of being a mother. Nothing compares. So if you want to be a mother, I want you to bring out your best. If you want something extraordinary, you need to go the extra mile. So what are you going to do in 2021 differently to get something different? If you have been doing what you've been doing previously, are you going to keep doing what you're doing and you expect the same outcome? No. The definition of madness is doing exactly the same thing you've been doing that didn't give you results, and you're planning to do it, and you're planning to have a different outcome. No, you can only give what you have, and you can only, have what you give. So I encourage you to acquire the knowledge, change your attitude, change your practices, and become. If God woke you up today, despite the fact you don't have a baby today, it means that God has a plan to make you a mother, to make you a father in 2022. Okay, so that's a way of introduction to this clinic. Today's clinic is going to now be completely a build up to that summit. So if you need to ask questions, if you haven't registered, if you need clarifications, this is an opportunity to register. Now the clinic is going to open. Focus on my admin. If you need to subscribe, follow them. If you need to register for the summit, follow them. If you need the PDFs, the latest PDF we have is on multiple pregnancy. Young man, open that door. Dumeje? Do you understand you're distracting me? Close that door and please reduce your volume. So sorry, guys. So we need to be organized. Very important. There are so many good things happening in the group. There are so many services you can use. If you're desiring to be a twin mother, a triplet mother, a quadruplet mother, it can happen to you. It has happened to other women. So get the PDFs. If you were not able to attend the live event, get the PDF. It's 50% discount. My people, do something different. Get different help. Do something different, please. Don't just allow 2021 to go by. Then you've already written your scripts for pity. Let nobody pity you. The biggest pity you can get from life is from God. If it's no God, believe me, life is important. The most important thing is that you have life. So don't allow anybody pity you. The same people that pity you in the morning that might be the people that will gossip with you in the afternoon. Don't allow anybody put you in a position where you will start looking yourself up in the mirror and you begin to wonder if you've gone crazy. You haven't gone crazy, my sister. You haven't gone crazy, my brother. You're just going through life and you will overcome. So now, please ask your questions. Remember to introduce yourself. I need to know your location. Then when you're done telling me your location, ask your questions. The clinic is open. Once I get your questions, I will start attending to them. So admin, if you identify any question, I'm going to put it on the screen. Then I'm going to provide you feedbacks. So the clinic is open. Please go ahead and ask, and I'll provide you feedbacks. Okay, if you need anything from me, please follow my admin. The operating officer is in the house. The moderator is in the house. The backup provider is in the house. The graphic designer is in the house. So we have a full house. And please make good use of this opportunity. Hopefully in the next, I normally spend my clinics for like 30 minutes, but it's weekend, so I might give extra time, depending on the questions I have. But right now, please ask your questions. Go ahead and ask your questions, please. Okay, I'm scrolling down. Let me see if I have any questions. I need to know your location. Your location is very important. Hopefully, by the time COVID is kind of resolved, we are going to look at ways North America members can come together. We don't run by, numbers. We have some dedicated people. So we're going to see how we can all come together and kind of have a reunion for people in America and Canada. So I applaud you guys. You guys have been amazing. So I appreciate you guys a lot. Okay, but right now, guys, ask your questions. It's question time. How are you getting ready for the summit? Now, if you're not asking, I'm going to ask you. How many have registered for the event? How many people, admin, please put this in a very big canvas. How many members are attending the upcoming Clomid and Fibroid Summit? How many of you have registered? How many of you have fibroid? How many of you have used Clomid in the past without the right way? Please, I encourage you to do the right things. Please. Okay, but I'm still waiting for your question. How can you join the summit? Follow the admin. Admin is going to share the links. All you need to do is to just register. Then make sure your partner is in attendance. It's going to be on a Sunday. It's going to be by 9 p.m. The reason why we choose 9 p.m. is to make sure that everybody is ready. So there is no excuse. If you have kids, tuck the kids in. Grab your water. Grab your popcorn. Make sure to make love every masterclass. We encourage couples to make love. We don't time our love making. We don't keep our love making for the time we feel we are ovulating. We don't keep our love making for the time we feel we are in a fertility window. No, we make love around the corner every 48 hours, so long as you're not bleeding. Now, some people also make love during their bleeding. Some women can become pregnant when they make love during their bleeding. It doesn't mean that you ovulated during your bleeding. It means that shortly after your bleeding, you ovulated. So some women can have short cycle shortly after making love. Like the normal love making rate, the normal bleeding in a woman is from 2 days to 7 days. So some people can make love towards the end of their bleeding, and shortly after their bleeding, they can release the egg. Once you release the egg and you have available sperm can spend up to 5 days to get you pregnant. So some people prefer making love during their bleeding, and some can get pregnant when they make love during their bleeding. But it didn't mean you ovulated during your bleeding. It means you ovulated shortly after your bleeding. And for every woman to become pregnant, you need to ovulate. Okay? Please, let me also explain this. So many people are carrying very humongous fibroids, right? Now you go to a church. They brainwash you. They tell you you actually have pregnancy in your womb. Now listen to me carefully. There is no baby that will survive inside your belly beyond 42 weeks. Let me repeat again. The average month for a baby to survive inside your belly in your pregnancy is 42 weeks, approximately 9 months plus. Once your baby gets beyond 42 weeks, that baby must come out by any means possible. We can induce you, we can augment, and ultimately we can section you and bring out your baby. When your baby is fully cooked, there is no other thing your baby is doing in your belly. So when they tell you that you've been carrying your baby for 13 months, for some people for 4 years, have a moment and think, my people. It's not possible. Okay, so come back home. You might have fibroid inside your belly, and we need to act on time. The better time we have, the better we can have a good outcome. The earlier you deal with this, the better. Okay, your fibroid is a foreigner. You don't need it. So attend, get the knowledge, then practice. Let's be knowledgeable. If a patient has PCOS and blood work is fine, what can cause delay? Now, my sister, you cannot have PCOS and your blood work is fine. Why? Polycystic ovarian syndrome is a complex that leads to inability of your hormones to function properly for you to ovulate. So when you have polycystic ovarian syndrome, likelihood that you will also have hormone imbalance is very high. Now, it's very easy to hone in on one particular aspect of whatever the doctor told you, then you focus on that. Now, this is what I know. Polycystic ovarian syndrome is a condition that can delay your ability to become pregnant. And almost 99.9%, your hormones are not going to be in the right place. There are key reproductive hormones that must function properly for you to become pregnant. Number one, your estrogen. Estrogen is the so-called female hormone. Your estrogen must be within the normal range. Unfortunately, as you are getting older, the level of your estrogen will be dropping. Now, correspondingly, there's another hormone that goes up when your estrogen is going down. It's called the follicular stimulating hormone. This is the hormone that will go to your ovaries and stimulate the eggs you already have. That's why it's called follicular stimulating hormone. The follicles are the vehicles that contain your eggs. So your follicular stimulating hormone getting higher when you're getting old means your fertility is dropping. When your estrogen is dropping, you will likely begin to experience dryness, hot flushes, low libido, irritability, It's normal. Every woman is going to experience reduced estrogen. Now, when your estrogen is out of range, the likelihood your FSH is going to go up. Your progesterone will also be low. When you have low progesterone, the possibility that that pregnancy will even occur in the first place is limited because your progesterone is the pregnancy maintaining hormone. Now, if you succeed in becoming pregnant, but you have low level of progesterone in your body, you are likely going to have miscarriage. Why? Because your pregnancy is not well supported. The cover of your womb, which is called the endometrium, functions under the role of your progesterone and your estrogen. So when your progesterone level is low, the likelihood that you will become pregnant, but you will either have miscarriage or stillbirth is high. So at any point in time in your pregnancy, we want to make sure that your progesterone level is high. Now, some women can also have problem with the FSH or the LH. LH is the luteinizing hormone. LH is the hormone that tells the body, you know what, the egg is about to be released, though, get the body ready. Once LH level goes up, within 24 hours, you're going to release your egg. Unfortunately, the egg is a very special cell. The egg is a very, very, very time-sensitive cell. Once it's released, if it's not fertilized within 12 to 48 hours, it's going to end. But the sperm can stay up to 5 days. So it's important we have adequate level of sperm in the vagina waiting so that anytime the egg decides to come, the sperm can swim and get the woman pregnant. These are the standards. These are the normal thing expected in the body of a woman. But you're in the world, you're going to have challenges. So some women are going to have hormone imbalance. Some women are going to have polycystic ovarian syndrome. So when you have polycystic ovarian syndrome, what do? Number one, you have to accept your reality. You have to accept that you need help. Some women can have polycystic ovarian syndrome and they wouldn't even know they can have your family. It might be mild, but you can complete your family. But there are certain things we need to correct. We need to make sure your hormones are within normal range. So you will need what we call an endocrinologist. Now, you also need a fertility specialist. Then besides that, you need to work on your body weight. When your body weight is within the normal range, you improve your fertility. When you are overweight, when you are obese, or when you are underweight, it depletes your ability to ovulate. So the body of a woman works like a computer. You are listening to me today from your phone. If your phone is not charged, you can listen to me, right? That's exactly the way the body of a woman is structured. So power yourself, charge your phones, have enough data. If you are seeing me right now, you're a mother. But if you don't have data, if you don't charge your phone, you cannot see me, right? That's exactly what you need to equip yourself so you can become a mother that God made you to become. Please, you are ovulating, but you can't get pregnant. What could be the cause? Your husband is fertile. Now, the question is how? There are some few percentages of couples that will be okay both sides, but they can't become pregnant. So if you happen to fall in this category, you have what we call infertility of unknown origin or unexplained infertility. When you have that, you still need help. So you're a candidate for assisted reproductive technique. You can go for IUI, you can go for IVF, you can go for surrogacy, you can go for donor egg, you can go for donor sperm. But unfortunately, some people will always think they are okay when they are not okay. The only person that will certify if you're okay or not is a fertility specialist. Sometimes you might think you're okay, but if you haven't seen a fertility specialist, if we haven't checked your hormones, if we haven't checked your tubes, if we haven't checked your womb, if we haven't checked your AMH, every singular woman that wants to become pregnant, we need to know your ovarian reserve. That is the most important test, because when you don't have X, there is no need wasting your time. You can only become pregnant if your ovarian reserve is good. If your ovarian reserve is depleted, you need donor eggs without wasting time. My sister, let me tell you the truth. You are gonna waste your time if as of this moment, you no longer have eggs and you have been waiting for 10 years. If you add extra 10 years on top of the 10 years you're waiting for, you're still not gonna have eggs. So it's important you know your status. It's important we know your ovarian reserve. Unfortunately, as you're getting older, they will be depleted. So any woman listening to me right now, if you are up to 35, you are advanced in maternal age. If since you started looking for a baby, you haven't gone for your FSH, we haven't checked your AMH, you are not doing the right things. We need to know the FSH, we need to know the AMH. Both of them can give us an idea of the remaining X, of the remaining quality X you have. Your X is what makes you a woman. If you don't have eggs, you cannot become a woman. Thankfully, you can borrow another person's eggs to become a woman. These are realities. There is no magic. It doesn't happen overnight. So you need to acquire that knowledge. You need to act on time. So if you are 35 years and above, you are considered advanced in maternal age. Why? Because your eggs are depleted every single second. Every singular woman is going to go through this phase. So there comes a point in time where you no longer have eggs. The best time to have all your kids are in your 20s. But unfortunately, you might not find your partner. You might not have enough money. You might not be ready. I will want you to be ready. I want you to act whenever you're ready. So even if you're 50, do what a woman in her 50 will do to become a mother. What you will do when you're 50 is not what you will do when you're 40. It's not what you will do when you're 30. There are different ways you can be a mother at 60. There are different ways you can be a mother at 50. There are different ways you can be a mother at 30, at 20. But your best time to have a baby is in your 20s. But you can still have a baby in your 60s. You can still be a mother in your 80s. But the method of becoming a mother in your 80s is only what? Adoption. If you are in your 60s, we can still go for donor eggs. So the older you get, the more difficult it becomes. But you can still become. Nothing can stop you. Let's continue, guys. So keep asking me questions. Keep asking questions. If your questions are not answered, don't worry about it. Learn from other people's questions, okay? So I'm going to go down. Let me see what I have. Okay, please, can PCOS induction help someone to become pregnant? Yes. So what you need to do, my sister, if you have confirmed PCOS, the only person that will treat you is what? Your fertility specialist, your endocrinologist. Your own duty is to work on your body weight. Because when you have polycystic ovarian syndrome, the tendency is to have increase in insulin resistance. Insulin is the hormone that handles all the sugar in the blood. So most people that have polycystic ovarian syndrome will have insulin problems, right? Now, some of them we might need to give anti-diabetic medication, which we call metformin. But what you can do by yourself is to work on your body weight. Once your body weight is within the healthy range, you can easily ovulate. So this is what you can do by yourself. Okay, guys, keep asking your questions. Keep putting your questions on the screen. Admin, keep sharing all the important PDFs, announcements. Please, at what age can a man not be able to fertilize a woman's egg? Most men, the same way women can have difficulties having a baby is also applicable to men. But men can still father kids in their 80s. The only problem is this. The babies you will have when you're 80, when you're in your 80s, might be prone to genetic problems, might be prone to, chromosomal abnormality, might be prone to your wife having miscarriage. So you can still father a baby at your late age as a man, but you have more risk factors. But the woman is entirely different. Once you have reached menopause, your egg is complete. But per ejaculate, during sexual intercourse, men release millions. So imagine millions of sperm competing for just one egg. That will tell you how wasteful the male reproductive system is. A woman is given about 400 eggs in her lifetime to choose to have your baby. So if you're to have all the babies that God gave you, you probably will have 400 babies, because every single month you release your egg, you can become pregnant. But that's different from men, because per ejaculate, we have millions of sperm, out of which only one will succeed in getting the egg fertilized. The union of the egg and the sperm is called an embryo. When it's happened in the tube, they need to come back and implant in the womb. So everything in the body of a woman is planned. Okay, so if you are in your 50s as a woman, what's the best thing to do for any woman in her 50s today to be a mother? Number one, your reality check. Number two, acceptance. So you can become pregnant at 50. How? Donor eggs with IVF immediately without wasting time. If you check your partner's semen and its poor quality, donor eggs and donor sperm can get you pregnant at 50. What's the other option that can get you pregnant at 50? Adoption. Which other option? Surrogacy. The same thing is applicable to women that are in their mid-40s. So the older you get, the more the likelihood you have a good outcome if you use donor eggs or donor sperm. But you can become pregnant. Okay? Very good question. Guys, keep asking your questions, please. I have a few more minutes to go. This is an opportunity to get feedback from me. Okay, let me see what I have. Okay, tomorrow is going to be Monday. We're going to run our Believing for Baby Clinic. Remember, our Believing for Baby Clinic is open to women that will become mothers in 2022. You do not have any business being in the same category next year. You are going to graduate. One of our members in BFB graduated over the weekend. She was getting ready to go for IVF and Mercy said no. So some of you might be shopping for money for IVF, but you're still making love to your partner, right? When you do that, you're challenging God. Our God is not deaf. Our God is not blind. And our God is not dumb. God knows what you're going through. But most times, we are the ones delaying. God is always on time. God is always showing us the way. But guess what? We want the broad way. The way of IVF is very narrow. But the way of Clomid is very wide. There are so many women that have used all the Clomid in the world, especially if you're in Nigeria. But that's not the pathway that will get you pregnant. The pathway that might get you pregnant might be fertility treatment, might be IUI, might be IVF, might be adoption, might be surrogacy. It's the same thing. Okay, so make use of your opportunity. You are individualized. How you will become pregnant is only unique to you. Okay, so let's continue, guys. Keep asking your questions. Check the PDFs. Find the ones that will be applicable to you and use it. What is the cause of high prolactin and can it be controlled? So your prolactin is a very important hormone that helps in the milk letdown. So God is so kind. God made the body of a woman to be so special. Now, if you are not pregnant and for some reasons your prolactin level begins to be up, you can have a condition we call hyperprolactinemia. It means the level of prolactin in your blood is very high. Now, when that thing happens, it can stop the other hormones that will help you to ovulate. Thankfully, we can correct that. There are some drugs we can give you to bring your prolactin level down. Most women that have high prolactin will also have what we call galacturia. That means you are not breastfeeding, you're not pregnant, but your breast milk is expressing milk. Your breast is expressing breast milk. If you are not pregnant, if you are not breastfeeding and you begin to experience milk coming out from your breast, that's a problem. We need to go and stop that because that can stop you from becoming pregnant. Okay, guys, let's see what we have. Okay, let's see what we have. Admin, please, you can repost any question I've missed. Okay, guys, I have a few more minutes and we can all go and get ready for tomorrow. It's going to be a very busy week for me. Okay, let's see. Good evening. You have high prolactin. Okay, so they've already given you the right drug, so take it religiously. Remember, nothing happens overnight. Some people will take something one day and they expect everything to be normal. No, it doesn't happen that way. So if you have high prolactin level, the drug you mentioned is a drug of choice. Take it religiously. Go back to your partner. Remember that for you to become pregnant, it's not just the woman. There are so many factors that might play a role before you become pregnant. So some people can come in and say, but doc, I'm perfect. Why am I not pregnant? Because you don't know what's happening with your partner. It takes you and your partner to become pregnant. You cannot become pregnant by yourself. So you might be perfect. You might have 100%, but your partner might have no sperm. And your partner might be handsome, tall, and you might think he's the best man in the world. But when we check the sperm, there is no sperm. A man that is rich, has houses all over the place, handsome, without sperm, it's a wasted venture. So what do? You need help. This is why you need to see a urologist. Every man in attendance, please take this back to your men because they don't like attending my clinic. They are so proud. They are watching soccer. They are protesting. They are in politics. Some of them don't even know the origin of what they're arguing about. But they are not seeking help. But they are abusing you. Meanwhile, the problem is coming from them. Tell your men, if you go back today, that if they gave them diagnosis of low sperm count, tell them that it doesn't mean they still can't get you pregnant. Matter of fact, if you are given a diagnosis of low sperm count, you should not just be making love every 48 hours. You should increase it to every 24 hours. Why? The fact you have low sperm count doesn't mean you can't get your woman pregnant. But unfortunately, if your partner has a zoospermia, it means there is no sperm. And the earlier you go for donor sperm, the better. This is no rocket science. This is not an argument. A handsome, muscular man can be forming, big boy, but there is no sperm. What makes you a man is your sperm. And you can discuss with your fertility specialist. You can make it confidential. You can get your donor sperm and you can start your family. Don't use your fertility issues to attack each other. Don't put it on social media. Don't tell your mom. Don't tell your siblings. Don't tell your friends. Some men are very silly. They go to the pub. They drink one bottle of Star. They begin to sing like drunken sailor. You begin to tell the whole world about your woman. This is the woman you promised heaven and earth. Then the slightest challenge you have as a man, you begin to castigate your women. It doesn't make sense. You are not man enough to marry. You are still a kid. A good husband will be in the forefront. A good husband will quickly submit the sperm so we can see how we can help them. A bad husband will be there blaming the woman, claiming that he's fathered the whole kids in the community. Anybody can father 12 kids in 2022, and this year you don't have sperm. Submit your sperm, young men. The earlier you do this, the better. Okay? All right. Let's wrap up, guys. The person that will be the guest presenter in this summit, you don't want to miss Dr. Ginika Ilechukwu. Amazing lady I've known since medical school. She's loaded. She's a woman like you. She's going to keep it real. She's going to share her word of knowledge. And she's actually amazing in real sense. So don't miss this opportunity. She's based in UK. She's going to come and share her knowledge. I'm going to come in from the Clomid perspective. She's going to come in from the fibroid. Then we're going to meet in the middle. Then we're going to crack the backbone of this Clomid and fibroid issue so you can become. The reason why I show up is to help you to become. And I know you can become, but I can't do your faith. I'm very faithful. I'm very believing. I'm very trustworthy. And I know that God will do it. Excuse me. But if you don't believe in yourself, who can believe for you? So I'm telling you, you can. It's no magic. You can. Okay? Guys, let's wrap up, guys. Let's wrap up. Where are your questions? Where are your questions? I have 15 more minutes. Admin, please, can you post the other questions? Let me go down. Give me 1 minute. Let me see what I have. Okay, so let's see what we have. If you have questions, please ask. I don't have a topic. I'm just trying to take you guys. Can varicocele cause infertility in a man? Yes. Varicocele is a known condition that can lead to infertility in men. Depending on the grade of varicocele you have, you might need to go for what we call varicocectomy. So we need to correct that, okay? But you need to be careful. You need to make sure that whoever is doing it is experienced. Once they make, guys, listen to me. Your powerhouse as a man is in your balls. Let me repeat again. What makes you a man is not your face. It's not your flat tummy. It's not your muscles. No, your balls, your testicles. Once we have problems in your testicle, you are an Ethiopian eunuch. What do I mean? You will have artificial castration. So anybody going to your balls must be experienced. If they damage anything in your balls, it's non-demeters. In my church, in my religion, non-demeters means, now Lord, let our servant depart in peace. It means once they damage it, they have introduced artificial castration. So you can be handsome, you can be tall, you can have muscle all over the place, but you cannot impregnate a woman. So what makes you a man is your ball. So you have to protect your ball by every singular thing in you. How do you do this? Be careful. You don't have any business wearing panto. The era of men wearing panties is gone. You wear flexible boxers so that air can go in and make sure that the environment inside your balls, it's good enough. Why? If you notice, your scrotum and your testicles are hanging outside your body. Why? Because the inside your body is hot, but the right temperature that will lead to what we call spermatogenesis, the process of producing sperm, needs a lower temperature to your body core temperature. So that's why your balls are hanging outside. Now, if you're wearing your hot boxers, or you don't exercise, you drive a long distance, or you swim in a very hot bath, they can increase the temperature in your balls, and when they do that, they can damage your opportunity of producing sperm. These are not rocket science. So the era of wearing pants is gone. If your penis is big enough, try and find out you can package it enough, but give your penis a space. The same thing is applicable to women. At the end of the day, when you've gone up and down, you shower, then you don't wear your pants to bed. So you can give enough space to make sure you are exactly how God created you. It's called going commando. So long as you're not bleeding, give your pelvic region a space. Let your vagina breathe. Very important. These are very, very important key points I'm sharing. Okay? So we need to know this. When you know this, when you practice it, you can become. Okay, guys, let's continue, guys. Can an 18 million count sperm fertilize an egg? The answer is what? Yes. But we are not just interested in the count. We are also interested in the motility and the morphology. Of all the three parameters in seminal fluid analysis, the most important one is the motility. If you're not going for IVF, we want the sperm to swim. A poor swimming sperm cannot get to the tubes. So if you have 1 billion sperm and they are all sleeping, you're not going to get pregnant. But you can have 10 sperm, fast swimmers. They can easily swim to the tube and get the egg pregnant. So motility is very important. And this is where you need to be careful. So many people waste the money they don't have. Your friend will tell you, oh, let's go and do HSG. Let's go and do scan. You use your money you can use to go and see a doctor. Then the doctor will decide the test you need. You use it to be wasting your money. And guess what? If you're in Nigeria, if you go to the lab person will tell you, oh, you have staph. You have candida. Do your urine. Do your fecal this. You're doing tests you don't need. And you don't have that resources. So the only person that should tell you the test you need are your doctors. When you have that test result, you take it back to them. Stop going for tests by yourself. Then you begin to shop for doctors that will interpret it. It's not going to help you. Some of you believe that once you have any complaint, if you don't give you antibiotics, then that person is a bad doctor. I remember an experience I had in Nigeria, Air Force Hospital, Nigeria, in Lagos. One particular guy came in with the wife, and if you know me, I stick to my gun. They came in, and I noticed the only thing they need is counseling. You just need to go and, take good care of yourself. So when I discharged them, they went about telling people, oh, this doctor doesn't know what he's doing because the other doctor prescribed so many antibiotics for me. When you go about using antibiotics incessantly, you can have antibiotics resistance. That means you can kill the good bacteria in your body, especially the body of a woman. The vagina has some good protective bacteria we call the lactobacilli, which protects your vagina and makes it to function exactly the way God made it. If you begin to take incessant antibiotics, it can kill off all those protective bacteria in your vagina and make way for the bad guys to come in and finish you. It's not all complaints you need paracetamol. It's not all complaints you need antibiotics. Some of you might have fungal infection, but you're taking antibiotics. Like if they tell you, oh, you have heavy growth of candida. Candida is not a bacterial infection. Candida is a fungal infection. What do you need? Antifungal. And candida and staphylococcus, whatever you guys call it, is not related to your fertility. You can have all the candida in the world and you can father a community. You can mother a community. Those are not the problems. So let's focus on the problems, my people. Okay? Do you need referral to see an endocrinologist? Yes. When you see your gynecologist will refer you to an endocrinologist. Okay? If you are one of our subscribers, we can send you directly to a fertility specialist. So you can circumvent seeing a gynecologist and you go straight to a fertility specialist. Remember that a fertility specialist is a gynecologist that trained only in helping people that have fertility issues. Prenatal multivitamin is advised for all women making love right now without protection. Whether it's with your boyfriend, whether it's with your fiancé, take your prenatal multivitamins immediately. The recommended period to take it is 3 months. Before the period you are anticipating to become pregnant, then 3 months into that pregnancy. Every singular woman that wants to be a mother must take their prenatal multivitamin. Now, it's not a fertility drug. So if you're in Nigeria, go and get your pregnant care. Your pregnant care contains an important multivitamin, which we call folic acid. Folic acid is going to help your baby's brain to develop properly. It's going to help your baby's spinal cord to be developed properly. It's going to help the neural systems to develop properly. So your baby is going to develop okay. When you don't take it, you can have what we call neural tube disorders, which can have a lot of problems. So you can prevent this by taking it religiously. There are so many formulations. Some people don't like taking drugs. We can give you gummy. We can give you the fruit flavor. You can even drink it. But whichever way, get your prenatal multivitamins. You cannot miss this. Okay? How many months can a miscarriage woman need to heal before trying to conceive? It's individualized. When you have miscarriage, it's very hurtful. When you lose your baby, nobody can tell you anything you will understand. It's hurtful. The pain doesn't go away. Anytime you've lost a baby, that baby, it's never replaced. That baby lives in your heart forever. What do you need? When you have cried, which I will encourage you to do. Look, anybody telling you not to cry. You know, some people can come, you know, when you have tragedy and say, oh, don't worry, don't cry. God is going to replace. It's a lie. No baby can replace each other. It has happened to me. I've lost my baby. Okay? My baby still lives in our heart. You know, so you have to create that space in your life to deal with your reality. When you're going through tragedy of losing somebody, you have to go through the emotions, right? You have to cry. Crying heals. When you're done crying, you can blame your partner, you can blame yourself, you can blame the doctor, you can be in denial. Then later, you accept. Once you accept, you book an appointment, you go to your doctor. When you're going to your doctor, we want to confirm that you actually have miscarriage. When we have confirmed you have miscarriage, we need to take an ultrasound. We need to make sure you don't have any remnants of your baby inside your body. Unfortunately, the same baby that will make you happy, when it's no longer viable, when we keep it inside your body, it can damage your body. So we need to get everything from your baby outside your body. Very, very important. Now, some women can expel this by themselves. Some women might be given some drugs. Then some women can go for evacuation. Now, when we've done evacuation and everything is okay, you need to recover. Recovery from miscarriage or stillbirth. Remember the difference between miscarriage? Now, admin, I'm going to award a free ticket to the upcoming summit. Where's my admin? Can you take a moment? And I'm going to give a trivia. Okay. So the right person to get it correctly, please shortlist 2 people to get it correctly. Tell Kene, the operating officer, if she's in attendance, to shortlist the 2 people that will get this question correctly. Okay, so guys, get ready. Okay, get ready. I'm going to ask this question. Who can tell me the difference between miscarriage and stillbirth? What's the difference between miscarriage and stillbirth? What time in your pregnancy can loss of your baby be called miscarriage and stillbirth? They are the same thing. It means your baby is no longer alive. But they are called miscarriage or stillbirth. Who can tell me the difference? I'm just looking for a number. 2 numbers. In the middle, admin, she shortlist the first 2 people to get it correctly. They will attend the Clomid, Fibroid, Getting Pregnant Summit, free of charge. The difference between miscarriage and stillbirth. I know some of you will rush to Google, right? I've been preaching it every day. All you need to do is to tell me the difference. Admin, shortlist, and we go. Okay? All right. So what's the difference between prenatal multivitamin and fertility supplement? Now, some people use that fertility supplement to confuse you guys. So you believe, oh, when you take it, it's going to do this, it's going to... There is no such thing, my people. Your prenatal multivitamins are the multivitamins that every woman that wants to become pregnant will start taking ahead on time. So it means prenatal. Natal means the state of pregnancy. So if you're in Nigeria, be on lookout for your pregnant care. If you're not in Nigeria, there are thousands you can take and you can become. Okay? So if you are making love without protection, you can get pregnant. What is the consequences of unprotected sex? Pregnancy and STDs. Now, gone are the days you lose your baby. Let me tell you the truth. If you have a baby girl who has started seeing her period, please sit her down and have an intensive course on reproductive system. Call it penis, call it vagina. Tell that lady how she can become pregnant. Tell her about contraceptives, because when she goes to school, she's going to experiment. We all experimented. For the people that are born again, born twice, born fourth, and whatever, we all experimented. Majority of people did not wait. You read your meals and bones, you want to try. Especially if you're in boarding school, you want to have boy girlfriend, because if other people are doing it, you feel like you're left out. So we'll all experimented. Our kids are gonna do the same. But guess what the difference? Growing up, our parents told us that if you touch a woman, she's gonna get pregnant, and we believed her. But guess what? In this era, the silliest thing you will tell your baby girl is to tell her, oh, if you touch her, they will finish you. They are wiser than us. So you sit her down, you tell her exactly what she needs to do. If she's going to college, encourage her about contraceptives. When they meet people they love and they like, because guess what? They are gonna like, oh, they are gonna date. Whether you like it or not, they are gonna see boys they like. They will like who they like. Who they like, you might not like them, but they like them. This is the reality of life. Now, the reason why I'm saying this, if your baby girl, if she's bold, if you guys are close, and she calls, oh, mommy, I haven't seen my period. A wise woman, you can rake, you can shout and say, I'm gonna kill you. Have we seen any woman that killed her daughter because she became pregnant? No. Your mother can swear from Jericho to Revelation and say, I'm gonna do this, I'm gonna do that. Once they see their grandkids, they chill. What your mothers are interested in now is your grandkids. So they don't care where it's coming from. So what point am I making? When you are old enough, when you are matured enough to make love, if you become pregnant, keep your baby. Do not, my sister, do not in your life remove your baby again. Why? Becoming pregnant now is like looking for American visa. It is tough. And unfortunately, in your younger age, when you become pregnant, you will likely go to a quack because you don't have money to see a gynecologist. And some good gynecologists will not give you abortion. Like someone like me, I'm pro-life. I love babies. Your babies can delay your academics. That's your consequences. Your mates can be higher than you. That's okay. For everybody, for every baby that God allows in this world, God makes provisions for them. So keep your baby. Why is it important you need to keep your baby? Because if you go for abortion, if you go for illegal abortion, they can damage your tubes, they can damage your womb, they can damage your cervix. And subsequently, when that beautiful lady at 30, you see your husband, your very fine husband, you marry. First year, no show. Second year, no show. And they begin to, because some people are coming to your wedding to look at your belly. That's a fact. Some people that come will start counting for you. That's a fact. That's what we do. We look into people's business that are not our business. But your business is to be wise. And you need to empower your girls because they will experiment. Whether you like it or not, you see that your baby girl, that innocent that goes to church every day, some of them will even have it for the first time in the church. It is what they're going to do. It's okay. But they need to know the consequences. Some of them will do it without protection and they can pick STD. They can pick chlamydia. They can pick gonorrhea. Somehow they are younger. Their body can weigh it off. Their body can push the chlamydia and the gonorrhea to the tubes. The chlamydia and gonorrhea can go to the tubes. They will be sleeping there. They will be on long vacation. So they can pick chlamydia at age 18 or 20. And combined with gonorrhea. Unfortunately, when you have sexually transmitted infection, when you have one, you can have multiple ones. So you can have gonorrhea, chlamydia, syphilis, even HIV, HPV in the same woman. And your immune system as a young woman is very strong. They are athletic. They eat a lot of food. So guess what happens? Your chlamydia and gonorrhea will go on vacation in your tubes. So you can run the whole of your 20s. Becoming a doctor, becoming an engineer, having a lot on it, looking shapy, going to gym, you are the slave queen, everybody wants to marry you. But you have chlamydia and the brothers and the sisters in your tubes, damaging your tubes. Now, by the time you're ready to become a mother, lo and behold, you have PID. Something we could have prevented and treated with 1 week antibiotics. The beautiful thing about having bacterial infection is the fact that if we develop a diagnosis of chlamydia or gonorrhea, we can treat you appropriately and you can take care of gonorrhea and chlamydia and you can be completely healed. But if you don't take care of it, you might not have the symptoms, but it's in your body, damaging your body. Be wise. Get the right knowledge. You were born a mother. Be wise. This is where knowledge is powerful. You know, some of you show up, and most times I feel like I'm wasting my time because you don't practice. The problem, you're complaining, you're contributing to the problem because you don't want to be a mother. You are so comfortable in your infertility. You have refused to subscribe. You have refused to attend classes. You have refused to see a fertility specialist. You are better at what your pastor and your friends are telling you, and you still want to be a mother. Meanwhile, the problem might just be HSG. Some of you have blocked tubes. They've been flushing your tubes since you were born. And the problem is that you need to go for IVF because when your tubes are blocked, you cannot be pregnant naturally. So what you need is real knowledge. You cannot cut corners. If you begin to take Clomid from today to forever and your tubes are blocked, you cannot get pregnant. Why? Because your tubes are the mechanical blockage. This is why we need to know what the problem is so we can attend to that problem differently. Very, very, very important. Okay, so admin, I hope you shortlisted the 2 candidates that will attend the event free of charge. Okay, someone is saying something about 20 weeks. So I'm going to give out the answer now. So it's actually 20 weeks. So the tiebreaker is 20 weeks. Any loss of your baby before 20 weeks is called miscarriage. Unintended loss of an intrauterine growing baby before 20 weeks is called miscarriage. Beyond 20 weeks is called stillbirth. Both of them means you lost your baby. Okay? All right, guys. Now, so many of our members are waiting for the results. They've taken bold steps. Some of them traveled to Nigeria to have their IVF. Now, I want to say a special prayer to a very amazing member of this group. You know yourself. Your test is coming out. Guess what? The affliction which has kept you for the past years will leave you. You are going to be a mother. You are going to live to say this. You're not just going to be a mother of one. The test is going to come out positive. It's going to coincide with a very amazing event happening on Tuesday. You are going to be a mother. You know yourself. For taking the bold step to help other women to become, despite the fact you don't have, but you helped so many women since 2015. You've sponsored thousands of women to get knowledge, and they are mothers today. Some of you became mothers. You didn't even know who helped you become mother. This particular lady, this is the year that broken cross will happen. You can mark my words. This is the end of this heartache. You're going to be a mother. You're going to get your positive test, and you're going to be an amazing mother. The same thing is applicable to all the women who are going to test for their positive pregnancy test. You are going to get positive. You're going to be a mother. And you're not just going to be a mother of one. You're going to be a mother of two. Until you finish your assignment in this world, it's not over. This is what we do. We are very few people, but we love each other. We back each other up. When you're happy, I'm happy. When you're sad, I'm sad. When you have your baby, I'm the happiest person out there. So learn how to look out for other people. Don't always show up in this group and tell Doc, answer. Some of you even get pissed and insult me because I didn't answer your question. We didn't sign a contract, my sister. Show up in this group. Look for people to help. I've been helping you guys since 2015. So I'm challenging you to look out for other people. Don't always ask what SGHS will do for you. Ask for what you can do for SGHS. Go and lift women that cannot afford services. Take 10, take 5, take 20. If you're blessed, sponsor them. It's not going to break your bank. Some of you are not able to become mothers today because all your prayers are selfish prayers. Gimme, 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 gimme. Meanwhile, God has given you the sound mind and health to become. But you're so interested in yourself that you have never helped anybody. There is no way you can be a good mother if you haven't loved people. Motherhood is love. Love is motherhood. So I'm challenging you today to step out from your comfort zone. If you want to sponsor a woman, I'm challenging you today. Let's actually have a challenge. Admin, take note of this challenge. What I'm telling you, I'm led to say this. I'm not a pastor. Big disclaimer. But look, I've been there. I've been to the mountains and I'm back. And I have a good news. Now, if you are led in the spirit to sponsor 10 women, 10 to the upcoming event, please tell the admin, yes, I can. I'm enabled. God has been good to me. I'm going to sponsor 10 women. It's not going to break your bank. Check yourselves. If you can, indicate Tell the admin, follow the instructions, 10 women. Now, if you can sponsor 5 women, also do the same. If at worst case, you can sponsor 2, follow the same. Now, let me tell you what's coming your way. By the time the 10 women you are helping get their blessing, you know the best prayer that God can answer without any visa application? Kiddies prayers, even in the Bible. God loves kids. If a mother you helped to become pregnant, to become a mother, prays for you, is direct entry to God. You can quote me anytime. Do you know why I have never had any luck? Do you know why? Because, look, I don't care if it's my last penny I share. And I don't know how. Every single end of the month, I always have enough to share, including my time. So when you provide for people, God will provide for you. This is not just a biblical injunction. It's reality. So step out there and say, admin, I am going to sponsor 10. I am going to sponsor 5. God has been so good to me. Dr. Chudi has helped me. Look, let me tell you something. I don't know you, you don't know me. But someday, you're going to know me. Someday, I'm going to see that beautiful child you got since 2015. This is 2021. On Tuesday, God is going to culminate this year with the beautiful blessings to me. If you know, you will know. But I'm telling you today, I have a good news for you. God is going to pick you up from your ashes to a place of beauty. The people that mocked you, the people that called you barren, are gonna show up in your party, and you're gonna stand on the stage and you're gonna dance the David dance in 2022, my sister. This will happen. You will live to say this. Now, some of you are praying little. Let me tell you, my God is a big God. When I say prayer, I say a big prayer. God has been faithful. Most times, the biggest storms bring the biggest blessings. Admin, capture that. If you are a faithful woman, if you are a prayerful woman, the reason why I'm standing today is because of my mother. My mother said a lot of prayers for me. Even when we felt at the end of the world is coming, even when we felt we don't know the direction, even when in 1999 my daddy died, my mother stood in the gap and said, go. This is a product of my mother's prayer. And you're a mother. So you begin to call forth your babies. Whether they are known or not, you call them forth. You begin to call their names. Say, come forth. These are your babies. Nobody can take it away from you. So begin to see yourself in 2022. A mother you are. Nobody can stop this. Look, you can quote me anytime, anyhow. Nobody can stop you, because the ultimate aim of God is to give you an expected end. And I don't care how long you have been on this journey. When God opens your chapter, God will shut up your own mouth. Because whatever God says he's going to do, he's going to do. God doesn't care if you're a Christian. He doesn't care if you're a Muslim. So long as you're a woman, God made you a mother. Period. You are a mother. And God doesn't make mistakes. The same way your mother gave to you is the same way you will give it is. You better let go. You look yourself up in the mirror and you say, you know what? This is the last time I'm gonna cry. The next time I'm gonna cry is the day I will stand on the stage and I'll be celebrated in this group. So I'm challenging you. If you don't know how to give, learn how to give. Some of us are very, very, very selfish. You have never given anybody anything, but you have gotten everything. That's not right. Learn how to share. We share a lot. Even things that don't concern us in this group. During COVID, so many people were hungry. So many people didn't have money. What did we do? We came together and gave our stimulus. Even when the federal government was hiding your stimulus, we came together, we packaged stimulus, and we were giving out money. A young man that was on the verge of death, we came together, we cried for help. You guys powered in to have excess. Daniel had excess money he's still using today. Daniel is healed. Daniel is going to be a mother and father someday. This is what love can do. This is what we stand for. This is my confession. So my sister, When you tell me about your fear, I tell you about my faith. And I'm telling you today that you can become a mother. You can become. Nobody can stop you from becoming. Nobody. So come up. Challenge that problem. Challenge the world. Sometimes you don't say nothing. You just show up in your village. Some of you have not gone to your villages. Why? Because your mates, your mother, some of your mothers are even the problem. They are look at your sister, look at your cousin. They have done this. It doesn't matter. Everybody has their own life to live. But I want you to enter your village 2022 with your twins. You are praying for one baby. Oh God, give me one baby. Come on, our God is a big God. God gives Jara. God gives extra babies. We've seen it happen. We're not bullied. So I'm challenging you today to step out from your fear and enter your faith zone. The best way to love people is to love them when they are in need. So go and love some women that are unlovable. Go and empower some women that actually need this help. Tell admin 10, 5, 2. Let me tell you, if you haven't loved, you haven't lived. And if you haven't lived, you haven't loved. So what the hell are you living for if you haven't done this too? What are you showing up for? What do you do with whatever God gave you? Use your talents to help people, especially people you don't know. 99.9% of you, I haven't seen you before in my very life. But I don't need to see you to know we belong together. So thank you for coming. But I'm challenging you one more time. Go out there and help somebody. Think less about you. And for this lady, you know yourself. You have not seen nothing. God is going to do it. God is going to put a permanent smile on your face. We will live to celebrate you in this group. Thank you for coming. I've actually exceeded my time by 11 minutes, but it's Sunday. I love you guys. Tomorrow is another day. Tomorrow we continue our talk for women that will become mothers in this group. You are going to be a mother in this group, whether you like it or not. Mercy will pursue you, will follow you all the days of your life. And God has made provisions for all the babies God will give you. I remember when we had Zara, and me and my wife, we prayed, God, please, Zara needs a brother. And along came Dumeja. If you notice, Zara is 10, Dumeja is 4. What happened between 10 and 4? 6 years. We also had infertility. Today, God answered our prayers. Zara has a brother. Dumeja has a sister. We have kids. If it can happen to us, it can happen to you. Go out there. Think less about you, but do something about your situation. Pray, play, practice. Pray, play, practice. Get the information you need. Get the knowledge you need. Stop sitting on the fence. Review your journey. January 1st, 2021. Oh, I'm going to do this. My New Year resolution. I'm going to have a David. I'm going to have Daniela. Do you have David and Daniela? Are you doing the right things? What are your family budget to help? What have you been doing to defeat infertility? Do you have a fertility specialist? Or have you been doing what you've been doing previously? And you're getting ready to complain again. No. I'm tired of having you complain. Because this is your time. I want you to tell me the good news. Look, I don't want to see any of our amazing women in believing for baby category again. No, you are on your way to ANC. You are a mother. You are occupying space for other women that need to come in. So God bless you, and hopefully you will heed to this clarion call. I love you guys. I'll see you tomorrow. Until I see you, God bless you, and bye-bye for now.